So we're all trying to get a handle on this big, beautiful bill and how to actually interpret it, what it means for Kansas and Missouri. And I saw this, a new report that was put out that says Kansas will lose $3.9 billion in Medicaid funding under the Senate-approved One Big, Beautiful Bill. Thousands still to lose coverage. David Jordan is here. He is the president and CEO of United Methodist Health Ministry Fund, joining us on 95.7 FM. David, good morning. It is great to have you here. And listen, there's obviously a lot of mixed reporting on how to interpret these numbers. How do you look at this from the standpoint of Kansas losing $4 billion in funding?
First, Pete, thanks for having me on this morning. Looking forward to the discussion. We wanted to know what the impact of this bill would have on Kansas, on Kansans, on hospitals, and on communities. So both the United Methodist Health Ministry Fund and our partner, the Reach Healthcare Foundation, contracted with a national firm to really model what the impact would be on Kansas. Based off of the modeling, which was grounded in data directly from Kansas hospitals, from the federal and state governments, really showed that 13,000 Kansans would lose health coverage as a result of the changes made in the Big Beautiful Bill. And Kansas, as you mentioned, would lose about $3.9 billion over the next 10 years. That will certainly have an impact on the ability of hospitals to balance their books, as well as the decisions onto what services they can offer. And it will ultimately impact Kansans' ability to access care.
So how do we interpret this when, those who are obviously championing the bill say, hey, we're just looking for people to work 20 hours a week or volunteer 20 hours a week to keep that Medicaid? How do we calculate these numbers without knowing what those 13,000 Kansans would do and what decisions they would make if suddenly they have to either work or volunteer or, do something else to get that Medicaid? How should we interpret that?
I think taking a step back, there's a lot of misinformation that's out there about the impact of the bill on different states. So how Kansas is impacted is different than Missouri. Kansas actually is not subject to the work reporting requirements, those added paperwork requirements. Missouri residents are as an expansion state. But in both cases, this bill, which was rushed through the process, adds a lot of red tape and government bloat that make it harder for hospitals and Kansans and residents to qualify for Medicaid. They're going to have to produce more paperwork. They're going to have to do it more often. And it's going to make it tougher for them to stay on coverage. So the coverage loss in Kansas is because of that extra red tape that Congress decided to add with this bill. We actually increased the size of government with this bill. And that's where you're seeing 13,000 kids, people with disabilities, seniors lose coverage because of the extra red tape added in this bill that's not being talked about.
Wow.
And much like that, to a larger extent, work reporting requirements or paperwork requirements. We're going to have to add extra bureaucrats in a state like Missouri to check eligibility twice. 85% of the folks enrolled in Medicaid are working, and the system they're going to create is just going to be extra red tape.
What kind of red tape are we talking about here?
I think we've seen other states implement work requirements, these extra paperwork requirements. You're creating extra bureaucracy for people to send in their state pay stubs on a monthly basis, to produce call logs to show that they were searching for jobs. In many cases, they may have a job. They may be taking care of an elderly parent doing home care. We need home care workers. So you're just creating bureaucracy, which can't keep up with adding, extra paperwork on a monthly basis that's being sent into state agencies. Sometimes postal delays make it tough to send mail to get back within 9 days. So there's got to be a better way to do this. And I think we need to be focusing on how to improve efficiency in government, get rid of red tape for businesses or for people trying to navigate unneeded bureaucracy.
So, is it really unneeded bureaucracy to make sure that people who are accessing government services qualify for it? Because I know a lot of people would say, hey, that's how it should be. Call logs, pay stubs, whatever it might be. Why would they lose that Medicaid And why is that not a good system to have in place to make sure the right people are getting access to Medicaid?
I think we all want to make sure government's working efficiently. We all want to make sure the people that are eligible, the people that are enrolled, I think you make sure you have a process on the front end. But when you start getting into 43 pages of applications in order to qualify things, just like taxes, we need to simplify the process. So I think we share the goal of making sure only eligible people are processing and making sure the system runs efficiently. I think that requires more money and more bureaucracy, and that sometimes can create more problems. So I think we've got to find the balance.
What would you say? I'm just curious. I haven't, seen anything in terms of numbers on this, but of the 13,000 people that you estimate may lose their Medicaid coverage in the state of Kansas, I know one thing that was a big national discussion is 1.4 million people who are illegals on Medicaid will lose that coverage too. Is there a percentage or a number of that 13,000 that you would speculate would be in Kansas and would be here illegally?
Yeah, I think for the most part, Kansas does an excellent job. One, from a legislative standpoint, we have a very lean Medicaid program. The people enrolled in Medicaid in Kansas are kids, pregnant mothers, people with disabilities, and seniors living in nursing homes. We have one of the leanest Medicaid programs in the country, and there's a lot of verification checks. So it would be very doubtful to me in Kansas you're having the same challenges that you just talked about in terms of undocumented folks being enrolled in coverage. But I think it goes back to how do we make the system better? How do we make sure we're balancing, making sure only those eligible, like in Kansas, are participating, and the dollars are being spent effectively. The bottom line is when you cut $4 billion from a program, it's going to have devastating effects. Kansas has more financially vulnerable rural hospitals than any other state. The average operating margin in Kansas is a negative 9.9% bottom line for the average Kansas hospital. So when you start taking, in this case, $2.65 billion just from hospitals in Kansas over 10 years, there's going to be some tough decisions made.
So what is the assumption then on why they would lose their Medicaid? If it's just they have to do more or they have to submit more paperwork, are we assuming that they won't know how to do it, or that the system won't be able to handle the amount of information that people have to submit? Like, how do we get to that number if what we've been talking about is just basically more verification?
Yeah, no, I think it's a good question. It sounds simple enough, right? But we all know sometimes we don't get, I think it's on both ends, right? Some people may not turn in the paperwork every month just because you may have different priorities, or you may not, you may be working multiple shifts, or you may be taking your kid to your baseball practice. Or in some cases, there may be delays in the mail. I know at one point when the state went through the redetermination process to make sure everybody enrolled in Medicaid was eligible, which is something that was necessary, they realized we're not getting mail back. And then they did a test, and it took 9 days to be mailed from an address in Topeka to another address in Topeka. So sometimes mail delays become an issue. So there's a lot of factors there, and I think, that you're really just moving paper around at some point, and that's going to cost more money than the one or two people that may fall off that aren't eligible, whereas other people were. And that's going to have impacts, that will ripple through the economy.
Mm-hmm. And how many people in Kansas are on Medicaid?
Yeah, right now, about 366,000 people in Medicaid. These are, as I mentioned, kids, pregnant women, very low-income parents, no single individuals allowed to be on Medicaid. A single mother with two kids earning more than $11,000 a year is not eligible. People with disabilities and seniors in nursing homes. So, as I mentioned, we have a pretty lean Medicaid program as it is.
There you go. Well, David, thank you for being here. Thank you for sharing some more on this study that you all did, and we appreciate you being on KCMO.
Excellent. I appreciate your time, Pete. Have a good one.
All right. Thanks so much. That is David Jordan joining us on 95.7 FM. He is the president and CEO of the United Methodist Health Ministry Fund after their report said last week that 13,000 Kansans would be projected to lose access to Medicaid for health insurance because of the big, beautiful bill.